Welcome back to the Mom and Mind podcast. I am your host, Dr. Kat. On our episode today, we are joined by Dr. Jessica Vernon. She is an OB/GYN and she is also a mom who has a lived experience going through perinatal mental health conditions. And I'm really excited for this interview and for her perspective because we all know in the field how many moms fall through the cracks. And sometimes those cracks are related to providers not having enough information on how to identify what a pregnant or postpartum mom is going through in terms of their mental health and wellness. And you'll hear in this episode Dr. Vernon's experience going through perinatal mental health conditions, but also how it has inspired her to do work in her field to help make sure that residents who are going through their programs as OBGYNs have more adequate training. And I really do feel like this is so imperative in bridging the gaps in perinatal mental health identification and assessment and referral for treatment. So, this is a big deal. It's a big deal that she is working on curriculum to make sure that other OBs get adequate training. Dr. Vernon is a board certified OBGYN and clinical assistant professor, Department of Obstetrics and Gynecology at the NYU Grossman School of Medicine. She also is an advocate for maternal mental health and is the director of perinatal mental health at NYU Langone OBGYN. In addition to mental health, she's passionate about health equity and is the physician advisor for the NYU Black Motherhood Matters Committee and the physician director of the NYU Holistic Care Program for Black mothers. She's been quoted in the media as an expert and has also shared her own experience with postpartum and anxiety and depression on national television. When she gave birth to her second daughter, she was able to implement the lessons and tools that she learned with her first child. She utilizes social media as well as her website and blog, Metamorphosis to Mom, to connect and share supportive, authentic content and curated resources related to the reproductive journey. So let's dive in and meet Dr. Jessica Vernon. Welcome, Jessica. Thank you for being here.
Thank you so much for having me, Dr. Kat. This is such an honor for me and so surreal because you were such a big part of my healing journey. I found your podcast early on, and now coming full circle, it really helps me and how I work with others along their healing journey and how I speak to them and the questions I ask and the conversations we have. So I'm so happy to be here with you and sharing this experience.
Oh, thank you so much. I just love that the resource is available to people and specifically for you that it helped. Um, as you know, I was saying a little bit before we started, I don't know where this goes. I'm just sitting here having a conversation and it goes out into the world. And I just love hearing where it lands and who it lands with and how it helps. So I appreciate that so much. And I'm glad it was here for you when you needed it. That's the
Definitely,
whole point.
definitely. And it still is. There's still so many things that are validating that I hear in your podcast and on your social media as well. So thank you for
Oh, yeah.
continuing to put it out there.
Well, yeah, I appreciate that too. And it's still validating for me. I'm, almost 13 years on in my experience, and every once in a while they'll still be like, "Oh, right." And I'll make a little connection that's useful for even me when I'm talking to people. So, yeah, healing journeys are a trip. Just so cool. I'm really excited to hear about your experience in particular. I think it's so useful for people to hear as an OBGYN that you also experienced and went through something like this. And I think people make assumptions about what certain professions know or can, or what they need or don't need based on these maybe antiquated ideas of what we have about, quote unquote, um, doctors, being sort of above the fray of things in a
Yeah.
certain way. So, yeah, I'd love to hear about your experience.
Yeah, and I think that those stereotypes, those visions of certain professionals really kind of feed into those illnesses when we have them, because we also
Yeah.
are sometimes afraid to ask for help or to look weak or vulnerable. And so it is important to realize that everyone is just human, and to be able to give ourselves that same care that we give our patients and the people we're taking care of.
Totally. Yeah.
Um, with my own experience, I had my first daughter 5 years ago almost,
Mm.
and I didn't feel like anything was abnormal really postpartum. I just felt like I was a hypervigilant new mom, and I felt that what I was experiencing was normal. However, looking back, I know I definitely was suffering from severe anxiety and
Mm.
OCD. I had a lot of intrusive thoughts. I was constantly checking on her. I
Mm.
felt overwhelmed and irritable. Um, I was not sleeping. And I felt it was very hard to leave the house worrying about what other moms would think about me, or if my
Mm.
daughter was crying, or things weren't perfect, how it looked to other people. And so I often felt very isolated and alone um,
Yeah.
in caring for her. And it didn't feel like something that I could reach out for help for, because I felt like every mom must go through this. Um, or if they didn't, then there was something wrong with me and I must be a
Mm-hmm.
failure in doing it wrong.
Right.
And so that continued for almost 2 years. And then the weight of it all and the stress and the constant anxiety turned into depression as well.
Mm-hmm.
And I got to the point physically where I was just constantly exhausted. It was hard to focus and concentrate. I was still working as a OBGYN at this time. I was still seeing my patients, but I remember being in the middle of my day in the office and just having to like recollect myself. And it really took all of my energy to be like, okay, I have this many more patients to see this afternoon, and to really be able to get through the day and give what I could to my patients and take care of them. Um, and then COVID hit, and I was in New York, which was the epicenter.
Yeah.
And so that really compounded everything to the point where I was just at my low, and I knew that something was wrong. I didn't really know what it was. I still
Mm-hmm.
hadn't put it together that I was suffering from severe anxiety and now depression at this point. But I had had a history of anxiety in the past. And so I just went to my primary care provider and said, can you put me on Zoloft?
Mm-hmm.
And I noticed a difference pretty quickly. I could get a little
Fantastic.
bit of space from those constant thoughts in my head, and from the edge. I was constantly on edge, that started to go away very quickly. And so it was only once I was on medication that I was able to look back and think this was something going on the whole time since I
Mm-hmm.
had the baby. I just had never treated it because I didn't know.
And how long was that from birth until the time you got medication?
It was almost 2 years.
That's a long time to suffer. Man.
Yeah.
Yeah.
Yeah. And I feel that now, seeing other people, I feel that that's a very common experience, because people
Yeah.
just don't know what they're going through.
Right.
Um, and as an OBGYN, someone who has all of the resources, and being in New York where I can access therapists and psychiatrists and, all the other mindfulness type activities you could want to do. And still, I had no idea about this.
Right.
Um, it really made the weight of it so heavy to think about what everyone else must be going through in places where they don't have this access.
Yeah.
And as a provider who'd gone through extensive obstetrical training and had been practicing at that point for many years, I just didn't get the training. All we knew to look at was women who were very depressed, if
Mm.
they seemed to fit that quintessential severe depression, suicidal ideation. They didn't want to get out of bed. They thought of hurting themselves or their babies. We weren't taught about any of the other variations and nuances
Mm.
of perinatal mood and anxiety disorders. And so that experience really opened up to me the lack of training that we all had in this gap between what was out there and
Right.
what we knew.
Right.
And so that's when I started to focus my practice on educating myself with the comfort and knowledge to care for people suffering and struggling like I was, and then to help educate others as well.
Yeah, super. Like I said, that's a long time to suffer, and I don't know. I was just thinking about how it must have been for you while you were going through it, seeing other people who were pregnant and in their postpartum visits, and I like for me personally, I would after my experience, I would sort of like compare a little bit how I was feeling to how I heard other people talking about how they were feeling, like constantly trying to gauge if what was going on. And I wonder how it must have been for you to be meeting with patients.
Yeah, that's a great question. It At first, when I was going through it, I didn't have the insight into what was going on with me to
Mhm.
understand that this was something that I should be looking for in others. I didn't have the right language. I wasn't asking the right questions.
Mhm.
And so when I was seeing other moms, I was still getting a lot of that feedback that, oh, everything's great, it's
Mm.
going okay. And
Mhm. Mhm.
it wasn't until later, once I knew what was going on and was able to really ask the right questions and create a safe space for people to open up,
Mm.
that then I started really getting into the experiences of others. And now when I'm in the office, I always tell my medical assistants, keep tissue boxes in my rooms, because inevitably people will open up and they
Yeah.
tell you how hard parts of their experience have been, and they start crying. And it's just giving
Mhm.
them that space that it's okay, giving them permission to show that other side of it, has
Yeah.
really changed and show me how not alone I was.
Mm.
When I was going through it, I didn't know.
Mhm. Right. So then people weren't um the things that would have been on your radar is that like severe stuff that you had been taught. But still it doesn't sound like taught a lot about.
Not, no, not taught a lot about. And when I went through training over a decade ago now, we weren't routinely screening.
Mm-hmm.
Um, the American College of OBGYN really didn't have a lot of guidelines in place then.
Mm.
Um, and it wasn't really part of our routine practice. We'd go in, we didn't talk about it at all during pregnancy. We didn't even know about these things occurring in pregnancy. And postpartum, we saw them once at a 6-week visit. And it
Mm.
was mainly, how are you feeling? How's the baby? How is
Mhm.
everything? And when you go in with that sort of energy, then people typically respond, I'm great, the baby's great.
Mm.
There's not much room. It's like when you see someone out on the streets and you're like, hey, how are you? And they're like, I'm great. But they're not like, well, actually,
Right.
this really hard thing is going on right now. And so I realized it from my own experience with my obstetrician as well. She was a wonderful obstetrician. And I feel like she hinted to me in ways that maybe she'd had an experience
Oh, interesting.
um, similar looking back on it, but she never came out and talked to me about it. We weren't being screened in that office at the time. And so at my postpartum visit, I'm a hypervigilant new mom, and this is how I'm
Mhm.
supposed to be to take care of my baby. So I said the same thing. Everything's great. I'm doing wonderful. The
Mhm.
baby's thriving. So everything must be good.
Yeah, right. Oh, like you said, after you kind of figured out what was going on, what was the thing for you again that kind of tipped you off that it might be time to get other help?
Oh, well, that was just, I knew that something was really off. And I was like, it's either my anxiety again, or I have something like an autoimmune disorder or a
Mm,
cancer or something
mhm,
else that is
mhm,
making me feel this terrible. And so
mhm,
getting on the medication. And then after that, I started seeing a therapist
mhm,
and I started doing some reading. And I actually read the book Ordinary Insanity.
mm.
I don't know if you've read that or
I know of it. I haven't read it.
yeah. Um and I had just read an article about it in the New Yorker and I started reading it and I was like, wow, these people have some really extreme OCD and other things going on that's not like me. And then as I got further in the book, I was like, oh, I did that. Oh, that
Mhm,
these are things that I've been thinking. This is stuff that has totally been going on with me. And so that was kind of my aha moment. Like this isn't just anxiety related to the pandemic and stress of life. This is something that has been going on since I had my baby.
mhm. Yeah. Okay. And so I know, based on what I know of what you're doing now, it sounds like things completely shifted for you in your practice and how you work. And I mean, you gave us a glimpse into it about how you talk to people differently now.
Mm,
But it's also set you on this other path. So what has come of your experience in your profession?
sure. So this has become my passion and my mission to work with other birthing people who are having similar experiences from infertility to pregnancy loss to like complicated pregnancies, history of anxiety and depression and postpartum depression. I have a lot of patients too who have a history of obstetrical trauma and
Mm-hmm.
they come to me for their subsequent pregnancy. Um, because they need that extra care and support. And and because I've gone through it, I know it's so important to take that time to provide that.
Mm-hmm.
And so to really help me do that, I started doing some training on my own through the Selene Institute, through Postpartum Support International. I also did a lot of reading with the work done in Massachusetts, where they train primary care providers with algorithms to be able to diagnose and treat uncomplicated anxiety and depression. And I have some really great reproductive psychiatrists at NYU where I work, which I didn't even know was a field, by the way, until
Mm.
after this all happened to me. And I started saying, we need better resources.
Yeah.
And just stumbled upon them and they're amazing. And so I've kind of created my own training in this, which has really helped me create a niche with taking care of patients who are facing these struggles. And it's been the most rewarding thing I've ever done.
Mm.
Sure, you see it the same when you see
Mm-hmm.
someone who is just struggling so much.
Yep.
And then when they're able to feel like themselves again and actually just be in the present moment and be enjoying their baby
Mm-hmm.
or have a day where they're not just so anxious and stressed during their pregnancy. It's just it feels so good to bring that care and that support to someone.
Yeah, it is amazing. It's like it's one of the best things to be able to see somebody have relief, especially because a lot of people don't totally believe that they can feel better. Well, when they're really, really deep in it, it's hard to see how things could be different, and then they get there, and it's so awesome. Yeah, it's super cool. So um, I mean, you're doing a lot of really important work in your field, and trying to train up and coming OBs on this. What's been the reception, I guess, to the information you're sharing?
Among the trainees, it's been amazing. Um, one of my colleagues who actually just had a baby very recently, her and I have worked together for the past couple of years, and she is actually the program director for our residency program now.
Mm,
And we got a grant together to create a curriculum for trainees. And then we started working with the people from the National Curriculum of Reproductive Psychiatry as well. And now we have a nationwide collaboration of obstetricians and psychiatrists to take the information that they've created for psychiatry trainees and distill it down to the level needed for OB trainees so that they can have the basic knowledge and comfort. And at NYU, we did the first lecture series last May, actually, for Mental Health Month.
Mm-hmm.
And we did a series of 10 didactics and had a grand rounds. And they were so receptive. I think it's really encouraging to see the younger generation of people really focused on holistic care
Mm.
and looking at the behavioral and psychosocial aspects of caring for people and learning how to have these difficult conversations. Um, and some of them have really been interested in doing further research and considering doing a combined type residency fellowship so that they can get more training than I've been able to get on my own, so they can really be fully equipped to be an obstetrician who has the ability to treat more complex patients as well.
Wow, that's really awesome. I mean, one of the things that I love about it is that speaking to the holistic part of it is that we're trying really hard to break away from things being so siloed that
Mhm.
OBs only deal with pregnancy and that's it, or whatever, to be overly simplistic. Um, that the kind of like I said, up and coming OBs are really receptive to it. And I kind of wonder if you've been able to interact with, maybe OBs who've been in practice for a long time and didn't get this kind of training, if they are also learning about this and integrating it into practice.
That's a great question. There are different levels of desire to delve into this. I think it's complicated, especially for providers who are in private practice, because
Mm,
often when I talk to them, they just they don't have time. They're not
mhm,
built for providing this extra layer of care. A lot of them
mhm,
haven't even incorporated routine screening yet
mhm.
because they don't know what to do when they get a positive result.
Yeah.
In our office, we've built an integrated model with reproductive psychiatry and therapists. So we have people that can treat, and I treat patients as well. But a lot of private practices, even in a place like New York, you might have some resources that take insurance, but a lot don't, or a lot don't take all insurance,
Mm,
or there's very long wait times. And so there's always this need to develop better systems where once we diagnose, how can we get them the care they need? Otherwise, it feels like an effort and futility when you say,
mm,
hey, your score was very high. I think you're at risk for this, but I have nowhere to send you. Call your insurance provider and see if they can
mm,
help.
mhm. And that I think it still happens quite often for people who are screening. Um, yeah, it's really quite a challenge because I mean, the OBs themselves have roadblocks to being able to provide.
Mhm.
Um, I mean, you've really had to create a whole different kind of a practice in order to.
Yeah. Yeah. And it's more time intensive.
Mhm,
It takes a lot more energy, doing therapy. It's, it can be draining. It's very rewarding, but it can also be draining. And when you
mhm,
see patients every 15 minutes, you don't really have that pause in between for self-care and reflection and taking care of yourself as well. So it is hard finding the balance between providing that level of care and also taking care of yourself
mhm.
and, and being able to address everything that the patient needs in these little time periods that the system gives us to take care
Right,
of people.
right, for sure. So in speaking of to a little bit more about what you're doing in your professional work, I mean, you're doing quite a bit at NYU. Can you speak to some of the kind of programs and initiatives that you have there?
Yeah, so the one program that we've really built out from scratch the past couple of years is a perinatal mental health integrated program in our faculty group practice. It's a large academic group practice with a lot of high risk obstetric providers as well.
Mm,
And
mm,
so we see a lot of patients who are at very high risk for perinatal mood and anxiety disorders. And I would say our rates in our population are much higher. I mean, we've just started really getting good with our screening. So I think we're going to have that data
mm,
in the next few years. But we have a lot of patients who are very anxious, and then others who've had other complications that make them high risk for struggling during pregnancy and postpartum. And so now they get screened at the initial prenatal visit, again at 24 to 28 weeks, and then postpartum. And we use those screeners to help funnel them into services with our therapy, medication with a psychiatrist, or by an OB provider if they're not deemed as high risk. And then we also collaborate with others in the community to provide additional resources and services. And that has been great, not just for people who screen positive, but also learning about the risk factors and teaching colleagues about the risk factors for PMADs. And so when you see a patient who's doing well initially, but she had infertility, she's had multiple miscarriages, she's a 40-year-old first-time mom, you can say, hey, you're at high risk for these things happening. Let me know if you want to see our therapist, if you want any additional support resources. I always recommend Postpartum Support International for their
mm,
support groups and resources. And just giving them permission again to say, oh, I am struggling, and it would be great to have this extra help, so that we're on the same page. They know we're there to support them, and it's okay to reach out and ask for help. And then we've also been integrating some of those aspects in the inpatient side as well. So patients who are admitted with, say, they broke their water early, or they have severe preeclampsia and they're far from being delivered, our reproductive psychiatrists are also able to rounds on them and see them in the hospital and integrate them into care that way, which is wonderful.
yeah.
And then we've also created another program specifically for our Black birthers, a holistic care program, because not a lot of our providers are Black and Brown people. And so giving them a layer of support, which is in this case a nurse navigator who connects with them throughout the pregnancy, does dedicated support groups and birthing classes. It's unearthed a lot of things that are so helpful for people who might not feel comfortable telling me something that they're feeling or that's going on.
Mm-hmm.
And then that nurse who's been in communication with them can circle back to me and say, hey, I'm really worried about her. She seems to be suffering from severe anxiety. Can you see her? And so it's another way to loop in and get people who might be lost in the system, which we know BIPOC patients are at higher risk of PMADs and lower risk of getting support, and just all
Mm-hmm.
those other layers of being able to connect with someone who looks like you, and
Mm-hmm.
the ways that that can help in their care, I think has been really great.
That's awesome. As you were talking about it's just, it sounds like multiple layers of being able to have touch points with people and provide resources. This would be cool if everybody could do it. And if like the model that you guys have put together, um, I'm just thinking of other physicians of whatever type who is hearing this, can also hear that this could be possible, with some time, developing something with time to um, just to be able to not, how people fall through the cracks, and get them
Mhm.
to the help that they need.
Yeah.
And more people are doing this kind of integrative support where there's a therapist in the clinic or in the OB clinic.
Mhm. Yeah, we know how helpful that is, and having someone who's a specialist in that area, because I've had so many patients who have had providers, therapists, psychiatrists outside of the perinatal period, and then they get pregnant and they want to see our providers because sometimes their providers aren't knowledgeable. A lot of psychiatrists were not trained in this area as well.
Yeah.
Um, or their therapist might not recognize the specific symptoms of anxiety and depression that are different in pregnancy and postpartum than in the general population.
Hmm.
Also, patients with a history of trauma or obstetrical trauma and how that impacts their pregnancy or
So
perinatal
much.
loss. It's just, there's so many aspects that you really need someone who understands this.
Hmm.
And I feel like we're starting to get more therapists who are doing additional training in this area too, which is really awesome.
Yeah, thankfully. Still not enough, but yeah, more and more people of all professions who um are in contact with somebody who's dealing with fertility, pregnancy, birth, loss, postpartum, like all aspects of it. The better outcomes really for families all around.
Mhm.
Um,
Yes. Yes.
Moms, dads, partners, babies, birthing folks, like everybody is better off for a long time if they have the right type of care and support during this window.
Yeah,
Um,
100%. And I'm often having that conversation with pregnant and postpartum people as well, as treating you is treating your family, and caring for yourself actually decreases the risks for your baby.
mhm,
And especially conversations around taking medication, which many people are very resistant to do, understanding that
mhm,
there's some risks of anxiety and depression as well. And so it's
mhm.
not just a selfish act. If you decide to take medication, sometimes it can really benefit the baby and the whole family as well.
Yeah, absolutely. So with all of the training you've had and the work you're doing, you have just such a broader view of the impact on other people, but also on yourself.
Mhm.
And in your own experience, obviously, looking back, you can see how you felt at that time. Um, but when I met you in person, you had a big old lovely belly, a filled belly, I should say. Um, and curious like how all of this impacted your pregnancy and postpartum.
Yeah, I mean, it took me a while to feel ready to have another baby. After my first, I didn't know if I would ever want to have another baby. And I made sure that I had a good plan in place when I got pregnant the second time. I also had to do IVF the second time, which is an additional risk. But I went through the whole process staying on my medication because I knew I would have higher risk of recurrence during pregnancy and postpartum if I went off.
Hmm.
And I had a good therapist and psychiatrist who knew about this area in particular. Luckily, we do have some good resources for that in New York. And I also made sure that I took time for self care. And
Hmm.
it's hard, especially is someone who's a very type A people pleaser. Doctors were known to just kind of pile more things on our plate. And when your boss or somebody's like, oh, let's have a meeting after work, or can you meet post call? I used to be like, yeah, no problem. And this time I learned to say no, and I learned what my limits were so that I could take care of myself and be rested and be whole and have energy to do the things I needed to do. I also made sure I had a really good sleep plan for postpartum.
Mm-hmm.
And luckily, I was able to get some extra help for the first couple of months so that I could get some good sleep. I also had a scheduled C-section, so I knew I'd be recovering from surgery. Um, and then the other thing that I talked through a lot with myself was breastfeeding. I breastfed the first time. I mainly did pumping. She couldn't latch on well, but I gave myself the grace to be able to stop breastfeeding or pumping at any time without feeling guilty or like a bad mom,
Mm-hmm.
because that
Mm-hmm.
is such a huge thing that
Yeah.
um, can cause stress and lead to decompensation of mental health. And so I made sure I had a good plan in place for that as well.
Mm-hmm.
And just making sure my whole support system, they obviously knew what I'd gone through the first time because I've been very open and talking about it. And so they were all prepared and very supportive. And I knew I could reach out for help. And um, that, being able to ask for help is such a hard thing when you're not used
Mm-hmm.
to doing it.
Mm-hmm.
Um, but just to be able to say, maybe I don't need help, maybe I could do it all, but I want help right now. And that's what's going to help me be able to be a better mom and be able to take care of myself as well. Um, that was a big difference. And the more I've asked for help and support, the better I've gotten at it. So now it
Mm-hmm.
doesn't feel like a failure on my part when I reach out to others, which is great.
Yeah.
So all of that really help prepare me. My husband and I also met with a therapist to kind of have a plan in place for our communication and make sure we were on the same page.
Nice.
Um, yeah, because that and being on the same page with your partner and them even understanding what's going on inside of your brain when you're postpartum is
Mm-hmm.
something that is very hard for someone who's never been postpartum. And
Yep.
so to kind of help them see and understand and anticipate what they need to do to support you best.
Yeah.
That was also another layer we added on.
That's so good. Yeah, you checked all of those boxes of there's all of the good things to do. Yeah, if you can get to it for sure. What was, I mean, in comparison, what was the difference for you? How was the second postpartum?
It's been so much better. I'm 7 months in, so we're not completely out of the clear yet. But I've done all the major transitions. I stopped breastfeeding. I went back to work. Um, I'm in a pretty stable place right now, and I actually enjoyed my baby this time,
Mm,
which is so different because I didn't realize how much I was in my own head and just so stressed and anxious all the time,
right.
um, that I don't really remember much of her early
Yeah.
life. Um,
Yeah. That's sad. That's hard.
yeah. Yeah. And so this time that was my big goal, was to be present and be able to enjoy some of those little moments. And of course, it's
For sure.
still a lot of work and it's hard and it's very stressful and you don't want to be there all the time, but just
Hmm.
being able to pause and be there present and focused on her has
Hmm.
been so great and has brought so much more joy that I didn't have the first time.
Yeah. I'm glad you got to um, experience it more how you had hoped and wanted to. It's really so I mean, I can relate to what you're saying. It's really difficult, even now sometimes that like looking back on the first postpartum and how much I missed, um, and how much connection we missed. It's
Mhm.
really challenging. Just those little like pangs of sadness still come up for me. Like I said, like we're cool. She's 13 and very 13. And but everything's good. But still, that's it's these are really important parts of our life. And if you can do all of those, things that you learned how to do, it just makes such a difference.
I was lucky that I had the capability and those resources available. A lot of people don't, and we know there's so many failures in our system to take care of people postpartum. Um, I took an extended maternity leave. I wasn't paid for a lot of it, but I was lucky enough that I could do that and that my job approved it and my family could afford to go without my income for a few months. And so many of those things that is a luxury to a lot of people here. Um, so a lot of my thoughts and focuses now are what can we do to better support people who can't afford these luxuries,
Mhm.
and how can we work on these big system changes within the system itself so that people aren't struggling so much during
Mhm.
pregnancy and postpartum.
Mhm. Right. And I mean, to that, the systems change part, there's sometimes it's easy to convince administration to support that, and sometimes it's not. Everybody has some sort of barrier within a system that you have to work with or work around, or you know all of that. So it's no small thing to change how your system is working, and it sounds like you have. So
Yes.
like this is like, how can one person make a difference? This is it. In these ways, of course people are around you and on board too. But it's this really important intersection of the lived experience and how it impacts your job. Like it just, right? You see things so differently after you go through it. You see how the system,
It's
yeah.
so different. And I look back at things that I've said that all OBs say, like when you're
Mhm.
training in your early practice, like you get out of an emergency C-section and you're like, why is she upset? She's okay. The baby's okay.
Got
You
it.
know, these are the things, or like
Hmm.
someone is very aggressive acting or very defensive, and it's like I'm doing everything I can for them, and
Hmm.
but you don't know where people are coming from, and you don't know
Right.
what's going on inside. And so just making space for those recognitions. And that's something that I work with a lot with my younger colleagues and the residents as well. Like, you don't know what part of this experience they're going to remember. And I've had people come back years after a miscarriage saying, how the provider told me, it's never left me. And
Mm.
it was so terrible. Or, well, I've had patients who had stat C-sections and said, well, that was fine. But then putting in the cervical ripening balloon, that was torture and that was traumatizing. And I felt like a guinea pig. So you just
Mm.
never know what things are going to affect people in what way. And so um, just approaching every step of the process, knowing that for us, it might be something we're doing every day, but for these people, this might be their only experience with the healthcare system and at their most vulnerable time and their most hopeful time. And
Mm.
so what we're doing can really impact them the rest of their lives.
Yeah, absolutely. The work that you're doing is so super important, and it's hard to know where, the rest of the system is within the US anyways. But there's so much potential here for practice to be done differently. What are your kind of, I guess, hopes for the OBGYN profession when it comes to this?
I think from my experience, what I hope for others is just making a more human connection
Hmm.
with their patients. As we talked about earlier on, often we have this veneer, we keep our guard up, we want to appear that we are all knowing and infallible, and that's really not the case. We're all human and vulnerable and have failures, and there's things we don't know. And I think just showing that side to our patients, being a little more humble and vulnerable, and giving them a space to relate to us on a human to human level
Hmm.
makes so much difference. Because
Yeah.
you never know someone else's lived experience and how that is going to impact how they perceive what they're going through in your care.
Hmm. Hmm.
Um, and that has made such a big difference, just allowing that space and that connection for people to open up and realize that I'm a person too, and I've had my own struggles.
Absolutely. Yeah, thank you for that. That would be cool if everybody could do that. Like every single person everywhere. Yeah, and you've translated this also into another space for people on your website, Metamorphosis to Mom, and writing about it, and just being public about it, and present for people to learn from you, and just really appreciate your visibility in that way and creating resources.
Thank you. I think if anything that we do can just help one other person feel less alone and more validated in their experience, I think it's worth it. And so I've definitely had colleagues and other people say, how do you do that? How do you put yourself out there? And it was not easy at first.
Mhm.
It
Mhm.
was really hard, but I stopped worrying about what other people were going to think about me and their judgments and just thinking about that person that I might reach and help. And that's definitely happened. I've had people reach out to me who are like, I really needed to hear this right now. And I'm sure you've had the same, that
Mhm.
um, it's why we do what we do.
Yeah. Yeah, absolutely. I thank you so much for your time and for all of the work that you're doing. It's so incredibly important. And um, yeah, thank you for sharing with us.
Thank you. Thank you, Dr. Kat, for everything that you do.
Please find and learn more from Dr. Jessica Vernon at her website, metamorphosistomom.com. And you can also find her on Instagram and TikTok at Dr. Jessica Vernon. For those of you out there who think you might be dealing with a perinatal mental health condition, please know that I have created really easy to use online courses that are on demand and available at my website, wellmindperinatal.com/online courses. I go over topics like how important sleep is and how to maybe get a little bit more, as well as how to recognize if you're having a perinatal mental health condition and some tools and tricks on how to cope during that time. And as usual, please do share this episode as far and as wide as possible, or just find that one person who you know could benefit from this information. It is so important that we're making sure that everyone knows that they're not alone. Thank you so much for joining us. Until next time.